Welcome to another episode of our in-conversation live sessions. Most of you are familiar with Around the Globe, but for those of you who are new, we're a hospital based in Philadelphia with over 30 years of experience in healthcare and an emphasis on ethical medical care. So today we have with us Dr. Mayank Uppal, consultant in internal medicine, who has been a core part of our COVID community and who has led most COVID-19 initiatives at the hospital. We also have with us Dr. Aman Sachdeva, consultant in health physiotherapy, who has helped many COVID-19 patients recover. Welcome, Dr. Mayank and Dr. Aman.
Thank you.
So to begin our session today, Dr. Mayank, after we come across many patients who display post-COVID symptoms, could you please maybe talk about a few of those?
Sakshi, yes, many of the patients, in fact, 50 to 70% of the patients who've recovered from COVID would experience some form of post-COVID symptoms. Most commonly, patients will experience muscle aches and pains, increased fatigability, decreased exercise tolerance, and the sense of feeling breathless even at the slightest of activities. Certain patients may also experience gastric symptoms like feeling of indigestion, bloating, and the urge to pass food perhaps after every meal. These symptoms usually last for about 4 to 6 weeks after recovery from COVID, and most of these symptoms settle down on their own with time. But if these symptoms persist, or if the complaints continue to increase in intensity and frequency, then you should consult your doctor for the same.
All right. And is there any specific reason that we're seeing many people show up with post-COVID symptoms now in the second wave as compared to the
Uh,
first wave?
Yes. Yeah. So there have been many hypotheses that have been put forward in the medical community amongst peers as to why this second wave hit us harder than the first wave did, and why are the post-COVID symptoms or post-COVID phases longer in this phase, in this wave as compared to the first wave. The few suggested hypotheses are that perhaps there was a different variant which affected most of the individuals this time as compared to the other, and the pathophysiology or the how the body responded to this variant and the intensity of infection to begin with, that this variant was different than the first wave. These are amongst the various formulated science, but yes, it is still open to discussion amongst the medical community.
All right. There are people experiencing breathlessness. Is there any specific advice that you would give to people who experience breathlessness?
Sakshi, when a person usually post-COVID complains of long spells of breathlessness, this shows that his lungs have become weak due to COVID-19 infection and capacity has reduced. So to improve this, we can teach him pursed breathing exercise. Pursed breathing exercise is where we breathe in through nose for the count of 2, and then purse our lips like as if we are trying to whistle, and then blow out through mouth for the count of 4. This to be done 2 to 3 times a day with 5 to 10 reps each time. This is effective as it improves the collateral ventilation.
All right. I think it would help to maybe have a video through which we can show our viewers exactly how the exercise is done.
Yeah. So as you can see in this video, in for the count of 2 and out for the count of 4.
Alright. I think that video was helpful to show our viewers exactly how the exercise is done. So, Dr. Aman, could you also maybe tell us about a few exercises that people can do at home to improve their lung function?
Sure, there are so many exercises which patient can do at home to improve their lung capacity and function. Few of them are segmental expansion exercise, thoracic expansion exercise, and deep breathing exercise or a diaphragmatic breathing exercise. So the most effective and the easiest exercise to perform is thoracic expansion exercise, wherein during inspiration you move your hands up above your head for the count of 4, hold it for the count of 2, and then while exhaling bring your arms down for the count of 6. So this can be done 2 to 3 times a day, 5 to 10 reps each time. Thoracic expansion exercise is very effective.
Okay. We can have a demonstration exercise as well.
Yeah. You want me to demonstrate?
No, we don't have a video that will be played just now.
You can see in this video during inspiration, you move your arms up above your head, hold it for the count of 2, and then during exhalation, bring your arm down for the count of 6. For the count of 6.
Again, that is helpful for the viewers. Dr. Aman, could you also maybe clarify what is meant by pulmonary rehabilitation and what is the difference in relation to COVID-19?
So pulmonary rehabilitation is a tail-raised program of exercise and education session for people who have chronic lung disease, chronic lung conditions, and it's very helpful. This can be used in post-COVID patient to reduce the symptom of breathlessness or dyspnea, to release anxiety and to minimize the disability, to improve the function and to improve the quality of life. And in this program, we progressive implementation of exercise is done according to the patient condition.
So basically, Dr. Aman, would you clarify a little bit more as to what all basically pulmonary rehabilitation encompasses? I mean, the viewers would like to listen to a little bit of what actually goes into pulmonary rehabilitation.
So pulmonary rehabilitation should include airway clearance technique, nutrition counseling, respiratory medication, oxygen supplementation, and stretching exercise protocol, manual therapy protocol, and graded physical activity and breathing exercise techniques.
I think you've mentioned a couple of very important points here. Nutrition is something that gets ignored, and simple airway clearing techniques and exercises are something which get ignored along the way. And patients tend to be at rest, lying most of the time, and that leads to cooling of airway secretions, which can sometimes lead to secondary infections. So I think 2 or 3 very important points here. One is very good nutrition. Sometimes these patients have prolonged illnesses and would require good protein supplementation, guided good protein supplementation. And many of them would be diabetics who would have to incorporate that aspect into the diet. And like you mentioned, airway clearance is something that needs to be taught to the patients or sometimes maybe to the attendants, so that there's no cooling of infections. So I think these are very good points you highlighted.
Right. And so as you have told us for all of these exercises, Dr. Aman, are there red flags or warnings that people should watch out for during the exercises?
So during exercise, major red flag is headache during coughing or doing any force expiratory exercises. Okay. Other red flags are dizziness, shortness of breath, or excessive sweating, cyanosis or a bluish discoloration over the nose tip or lips, and persistent pain, feeling of heaviness in the chest or the thoracic area. So these are the major warning signs. If you experience any of these, I would suggest you should get in touch with physician immediately. Dr. Mayank, would you like to add any more to this?
No, I think subjective assessment, as you mentioned, but like progressive difficulty in breathing or difficulty breathing, which sets in after you start exercise and does not get resolved within 30 seconds of resting after exercise. There are a few objective tests that could be added to the list. A 6-minute walk test could be done to assess your level of deoxygenation or desaturation. And then there are, I would just add a couple of points. Maybe perhaps patients with diabetes should monitor their blood sugars very closely, and patients who have coexisting illnesses like heart illnesses or maybe COPD or bronchial asthma should be a little more conscious about increasing their intensity of exercise. And any sort of chest discomfort or any unusual discomfort that they experience, including increased sweating, etc., they should consult their doctor before they go ahead with increasing the intensity of their exercise.
All right. So, Dr. Mayank, you mentioned just now about people who have diabetes should be monitoring their blood sugar levels. That also brings me to an important point in the sense that many patients often ask whether there are any tests or investigations that they should get done next week after the war. Can you maybe
Well,
tell
so
me
yes,
those?
yes. Well, so there's no prescribed format or there's no prescribed protocol of what test must necessarily be done by all patients at certain intervals after recovery from COVID. The investigation and, for that matter, the whole treatment plan should be tailor made for each patient individually according to whatever coexisting illnesses and baseline health status they have. But having said that, one important broad highlight I would make is that if you have a routine follow up for diabetes, for blood pressure, for heart illness, or for any other chronic illness that might have been gotten delayed because of you getting COVID, you should reschedule that appointment with your treating doctor and get that back on track. For diabetics, also, like I already mentioned, it's very important to keep their blood sugars under check. And for patients who are hypertensive or are suffering from blood pressure, they should have a BP instrument perhaps at home which can be used for home monitoring of their blood pressures and accordingly report to your doctor. But yes, certain investigations are of importance, great importance in post-COVID management. But you should consult your doctor so that you can have your investigation plan made out according to your needs and your health status.
All right. And also, there has been much talk about a green fungus lately. Could you
Yeah,
maybe
so
talk about that?
yes. So, well, it's very interesting how colorful names nowadays the media is coming up with. So, black fungus was incorrectly, though, referred to mucormycosis, and aspergillosis is now being, again, not very medically perfectly being referred to as the green fungus. But both these diseases are fungal infections. They are opportunistic infections, which means that they do not affect when your immunity status is good. But once your immunity level is down, which may be because of a illness like COVID or because of drugs like steroids, which have been used in for a very long period of time or in higher doses, and then you become susceptible to be infected by these infections. Two important points in terms of prevention of these infections is that never take unprescribed drugs, especially the likes of steroids, which can be very harmful if are not taken under strict medical supervision. Do not follow, uh, advice that you sometimes get on social channels like WhatsApp, etc., about various drugs or putting of various substances into your nose, etc., which could again lead to increased propensity of these infections. However, if you've suffered from COVID, have been medically prescribed steroids for a certain period of time, or had the requirement for oxygen for a certain period of time, if you experience any of the symptoms like pain around the eyes or forehead heaviness or a fever which comes back after you've recovered from COVID, then you should report these symptoms to your doctor and get these checked out.
All right. Okay. And Dr. Mayank, is there anything that you would like to tell our viewers about monoclonal antibody treatment?
I think your voice was not very clear, Sakshi. We couldn't get your question.
Okay. Could you maybe tell our viewers a little bit about antibody monoclonal treatment?
Monoclonal antibody treatment, is that right?
Yes,
Yeah,
that's
yeah.
right.
Yeah, document, yes.
Well, so yes, the latest amongst the armamentarium on the treatment of COVID-19 is monoclonal antibody treatment. If I put it very simply, uh, I mean, this is a very oversimplification, but just for the understanding of the viewers here, monoclonal antibodies are basically antibodies which are prepared in the lab against a certain antigen, which might be a viral antigen, as is in the case with COVID-19. And then these antibodies are purified to a certain concentration, and then they are injected into the patient with the idea that these antibodies will be able to neutralize a lot of the viral load or the virus particles that are circulating in the system, and hence reduce the load or the intensity of the infection. These right now have been given an emergency use authorization by the DGCA, which is the Drug Regulatory Authority in India, for use in patients suffering from severe COVID on high oxygen dependence or requiring ventilator support. So I think this is something still in the experimental stage, so to say, and something we've already experienced in the past with COVID, that most of the therapies that have been introduced with emergency use authorization have unluckily not proven to be very effective. Some have already been removed from the list of treatment protocols, like the convalescent plasma is now off the list of treatment. Hydroxychloroquine and other drugs have also been removed from the list. So it's something that we are hopefully watching, and the results for it are still not very clear as to its effectiveness.
All right. So some sort of a silver lining, I guess. All right, so that was a good discussion. We'll be taking up audience questions now. So if there are any questions our viewers would like to put in, you can message us or drop us a comment. We have one question. This is from Shipra. She says she has actually a detailed question. She says my CRP level was 11.8 during COVID. It reduced to 11.6 and then to 11.2 during home isolation. After weeks of recovery, do I have to now unfold timer and CRP because of my condition? Should I take any medication to reduce the inflammation? Dr. Mayank?
Well, so I think the concern is about the CRP levels, right? And whether the CRP values are something to be concerned about, and what can be done for normalization, right? Is that correct?
Yes, that's right.
Yes. CRP values are not something which are just limited to the COVID or the post-COVID phase. CRP can be raised for a variety of reasons in the body. COVID is just one of them. Singularly, chasing CRP values is not really required. The best would be that you get evaluated from your doctor so that we can look at the complete health status holistically, and then decide whether your CRP values, at whatever levels they are significant enough to be treated, or can we just wait and watch. But I think if I just look at what you've asked, CRP levels in isolation may not always be a reason for concern. If you are feeling otherwise better, and the fever has gone and your appetite is getting better, so then CRP levels broadly, singularly, should not be the reason of concern. But then, having said that, please get in touch with your doctor so that you can be evaluated completely.
All right, okay. Thank you. There is another question now. There is a question from Arpit. He says, I turned negative 2 weeks ago, but I still feel tired when I exercise. How much can I exercise? And for how long should I go till resuming my different exercise routine? Dr. Aman, would you
Yeah, Sakshi, tiredness or fatigue is a very common sequel post-COVID. As the lung is affected and the capacity is reduced, we often feel tired post-COVID. So you should take breaks in between exercise. You can exercise 2 to 3 times a day, okay, and do take care of red flags. And you this definitely you can return to completely to your pre-COVID status in couple of months. But again, it's different for every individual. I would suggest start with very basic exercise and then progress to high intensity exercises.
So, can I ask one question here? So, Dr. Aman, a lot of patients question about high intensity exercises, and as we understand, intensity of exercises is individualistic to an extent. Something which is high intensity for me at my age may not be high intensity for another person at another age. So, how should one judge as to what is normal intensity or easygoing exercise and what is high intensity for that particular individual? Would you suggest any objective assessment methods for this?
Yeah, Dr. Mayank, this high intensity exercise is different for every individual. Okay, the intensity of exercise we calculate through maximum heart rate, but again, to calculate a maximum heart rate is a very technical thing. So the easiest on the go way is to check the intensity of exercises through a talk test. Talk test is a simple test which a person can perform at home. Okay, and ideally they should, because this is a broad assessment, this is a very gross assessment. Ideally, patient should consult a physiotherapist for the physical fitness assessment, where a physiotherapist will assess the all five components of physical fitness before prescribing a high intensity exercise to the person.
Dr. Aman, would you elaborate a little bit on how we do the talk test? I think that is a very simple test, and I think viewers would like to understand how we do that.
So in talk test, if you can talk and sing without running out of breath, it means the exercise intensity is a low intensity exercise. And if you can talk and not sing without running out of breath, it's a moderate intensity exercise. And if you can only speak few words, it's a high intensity exercise.
And if I may put a lighter note here, if I try to talk and sing while I'm exercising, I would be stopped because I sing very badly. So that doesn't apply to me.
So it's
Okay, so going back to the other question. So there is a question from Ruchita. She says that I have been having a protein-rich diet, but I'm not sure what it exactly means. Meaning, what should it constitute? And will having too much protein and less physical activity, since she is not well, will that lead to or will that sort of affect the kidney function in any way in the long run?
Okay, so I'll take this question, right, Sakshi?
Sorry.
Shall I take this question?
Yes.
Yeah, so I'll answer it a little technically in the first part and then try to simplify it in the second part. Technically speaking, if your protein intake is zero point 0.5 to 0.75 grams per kg of your ideal body weight, it is the normal protein intake that you should have. If you are having 0.75 to 1 grams per kg of your body ideal body weight, it is moderate amount of protein, and if it is 1 to 1.5, it is high protein intake, which is what is recommended when we ask patients in the recovery phase of certain illnesses, especially those which have required prolonged rest and have caused a patient to remain bedridden for a certain period of time. This is the technical bit, but now it probably is a little challenging to understand what is ideal body weight for a certain patient and how they should go about it. So I would suggest is, if you have, let's say, a full plate of a meal, if you have a full plate of your lunch, for example, of that, if one quarter of that is something which is rich in protein, uh, one quarter and a half is something which is rich in carbohydrate, and the rest is fiber, which is like green vegetables, salads, etc., you are all set for a balanced meal. Now, it is very hard for me to here give you the list of what protein content in different food substances you would get out of. For example, animal protein is rich and higher in quality than plant-based protein. So, plant-based protein has to be taken in a larger quantity than animal-based protein to equate the same amount of protein. Also, your high protein diet will not affect you in any bad way if your kidneys at baseline are normal in function. Of course, this does not stand true from somebody who's already suffering from a kidney disease. But if your kidneys have been healthy, even a higher protein content than the 1 to 1.5 grams per kg will not affect you badly, and the kidneys will be able to very effectively clear that out. So that should be of no concern. But one important thing again here is that whenever you are eating higher protein, the body requires larger amount of water to metabolize it. So your water intake or fluid intake should match your higher protein intake. So with high protein diets, your fluid or water intake should be 1.5 to 2 liters per day. But your diet plan should not be, again, generic. It should be individualized according to your requirements, according to your BMI, according to your other existing illnesses, if you have any like thyroid or diabetes or hypertension. So again, it's a good idea to get in touch with a nutritionist who can advise the proper diet plan for you.
All right, I think that was well explained. So we have another question now. That is a question from Manisha. So she says that what sort of supplements should we take in the post-COVID phase? Dr. Mayank?
Well, again, for supplements, well, again, let me put it simply first and then a little technically in the second half. Simply put, if you have 5 different colors of food substance in a day, you don't need basically any vitamins and multivitamins or minerals, etc. Five colors. I would give you an example. For example, if you have white rice, if you have yellow dal, if you have red tomatoes, if you have a green vegetable, and so on and so forth. If you have 5 different colors of food items in a day, and 2 of these food colors are taken care of by a fresh fruit and a fresh vegetable, then usually your requirements for vitamins and minerals is taken care of. This is also the dictum for balanced diet that you should try to follow in your day-to-day life. However, in post-illness phases like in COVID, you do become deficient, and the body's requirement for nutrients as well as for micronutrients like minerals, etc., increases. So you could take a multivitamin which has the generic amounts of this. But again, I like to stress to my patients that it's always better if you can take care of yourself by a balanced diet. So try to follow this 5 color dictum in your diet, and you should be okay.
All right, that was quite a colorful example. Thank you for sharing that. There is a question from Monica Nanda. She says, is shortness of breath normal after 1 month of recovery? I think her pneumonia level was 12 by 25. So, how long, she's asking, how long will the body take to completely recover from pneumonia?
Uh, well, so pneumonia is something that she would have already recovered from. So I think there's a slight misinterpretation of the language here. Pneumonia is an infection, an active infection of your lung. So I would think that that has been resolved because it's been 1 month past her illness. The signs of the COVID infection, she says her score was 12 by 25. So I am assuming she's had a CT scan done. The signs of this in the CT scan could also persist for up to 8 to 12 weeks. That does not mean that she has active infection. That is just the artifact or the remnant of the injury that the COVID caused, and that will take some time to show recovery or improvement in the CT scan. As for the breathlessness persisting, I think I would like to discuss it a little deeper with the patient as to the intensity of the breathlessness. Is it the same as to when she got discharged? Is it increasing? Is it only brought on by a certain level of exercise, or is it also there on rest? Does she feel relieved by taking or doing certain things like taking steam inhalation or resting for 5 to 10 minutes? So these are various factors that we'll have to assess before we can say. But broadly speaking, post-COVID phases, like I already mentioned, may last up to 6 to 8 weeks, but should be progressively improving. If you're on the road to recovery, all these things should show some progressive improvement. If you think that the improvement is stagnant, or if you think that it is worsening, then again, it's better that you get yourself physically assessed by your doctor before you proceed further.
All right, thank you. Monica, if you're watching, you can feel free to contact us for a consultation with Dr. Mayank after this session. There is actually another question. She wants to know how much chest and breathing exercises should she do, and does excessive exercise harm you in any way, Dr. Aman?
Yeah, so she can again, as I said, she can start with 10 to 15 minutes. Start with 10 minutes 2 to 3 times a day and 4 times a week, 4 days a week, and gradually progress. Exercises to be progressed gradually. Start with a very mild breathing exercise, and then you can progress to high intensity breathing exercise. Okay, and this can be progressed over the period of 3 to 4 weeks post COVID.
All right. Then another question. It is from Shweta. She wants to know, can she resume treadmill exercise, and for how much she can do, and is it okay for her to resume the treadmill?
Yes, you can start using treadmill post-COVID phase, but again, as I said earlier, also start with a very slow, the speed of 1 to 2 kilometer per hour, okay, and gradually progress day by day, and start with 5 to 7 minutes on day one, and the maximum up to 25 minutes on the day 14th of your treadmill.
All right. Okay. There is one question from Kapil. He says that can he resume cycling now that he has recovered from COVID, and if he can resume cycling, is there any specific duration for which he can do it, Dr. Aman?
Yes, patients, then yes, she can do cycling, okay, but again with zero resistance, and 5 to 7 minutes on day one for 2 to 3 times a week, and then maximum up to 20 to 25 minutes on day 14. But this should be done without the resistance, free cycling. She can start doing free cycling. Yes.
All right. Okay. There is a question. There is a question from Mishti. She says, "How much time do I need to wait before getting the first vaccine dose?" Dr. Mayank, would you like to take that up?
Uh, so the guideline says that for people who have recovered from COVID, you have to wait for 12 weeks or 3 months before you get your vaccination. This interval is mentioned to be 8 weeks for frontline workers, healthcare workers, or people who are more susceptible to getting complications from COVID in terms of people who have coexisting illnesses like heart, lung, or kidney disease, pre-existing heart, lung, or kidney diseases, or those who are elderly or in any other way increased risk of getting the COVID related complications. They can get it done at 8 weeks post recovery. Otherwise, it's 12 weeks post recovery for all other individuals.
Okay. There is another actually, not vaccination, but post-COVID related query. The question is that they have just recovered from COVID and they want to know how long do they have to wait to resume consuming alcohol.
Um, surprise! You won't be surprised that this is in fact the most common question that I get of all the questions of resuming physical activity. Uh, but I would say that I do not in any way condone taking alcohol after COVID. But if you must, the safe guideline says that post recovery, wait for at least 3 weeks before you start taking alcohol, and when you the safe limit prescribed is 40 to 50 ml of alcohol for men and 20 to 30 ml of alcohol for women, which makes a small drink of whiskey if you have it, or a pint of beer for men, or a three-fourths of a pint for women. This is the safe limit prescribed by the Gastroenterology Society of India as well as the American standards. But again, like I said, alcohol is something which lowers your immunity. So try to avoid alcohol as far as possible.
All right. Okay. And there is one more question that we have from Nikita. She says that so far she has isolated herself as far as possible. But now that she's transitioned to the house, she wants to call a plumber over. Now, this is probably the first contact that she will have with an outside person. So she wants to understand, is there any specific duration for which COVID particles remain in the air?
Sakshi, I'm sorry, the first part was not very audible. Could you just briefly repeat the question?
Yes. So there is a question from Nikita. She says that she has been in isolation throughout this entire period, last year as well as this year. And now she wants to call over a plumber to fix some issues in the house. But because this is going to be her first contact with someone from outside, she wants to understand whether there is any duration for which COVID particles remain in the air before she can sort of interact or go outside.
So let me address this in two parts. As I understand, her concern is, one is that she wants to call in somebody from outside. Whether it is safe to call that person from outside is number one, and number two is, once that person steps into the house and moves out of the house, how long would it take for the air to be free for her to breathe safely breathe again? If I understand that correctly, right? So for the first part, I think let's together not decide that we don't want to unnecessarily be paranoid about anything or get over scared about things, but let's just keep our basics right and straight. One is that whenever you allow anybody from outside to enter your house, make sure that that person is wearing a proper mask and wearing it properly, covering both the face and the nose, mouth and the nose. Make sure that you sanitize the person's hands or ask them to sanitize their hands before entering your premises. If possible, ask them to wash their hands with soap and water if that is possible, or just maybe sanitize their hands with an alcohol based sanitizer before they enter your premises. While they are in the house doing your job, make sure that you maintain a 6 feet distance from these individuals. You should also be wearing a mask if you need to supervise the repair or the person. You should also be wearing a mask, but while maintaining a 6 feet distance, a minimum 6 feet distance from that person. Once that person is done with the job, if that part that the person has worked on can be sanitized, make sure that that part is sanitized again. For example, you are calling in a plumber. If he's working on a tap, make sure that he leaves after he's left the workstation, the tap and the surrounding area is sanitized with soap and water or with an alcohol based sanitizer. As far as the air is concerned, if it is a freely circulating or a room with a freely circulating air which has doors and windows, you can keep the doors and windows open with the fan open. And if you have just a couple of air exchanges in that room, you're almost clearly set as to avoid any infection from that person. The air basically is not a concern. It's the basic direct contact that you have with the person then and there, which you should guard yourselves against. And like I said, just once the person has stepped out, keeping the area in freely circulating air, keeping the fan on just for maybe a couple of minutes to 5 minutes would allow enough air exchanges for the infection, if any, in the air to settle down completely and make it safe for you.
All right, that was well explained. We have another question. This is from Divesh Kumar. He says, "Is it normal for for anyone to have pain in the ribs while sitting on the chair? Only that. And in that kind of a situation, what should they do?"
So I'll take it up for the first part, and I think certain parts will be answered by Dr. Aman in this. So the first part, pain in the ribs, or for that matter, pain in any part of the body is not normal. Not normal. But whether it is expected, yes, a few patients with COVID, especially those who've had severe infection and who've had breathing difficulty to begin with, may experience certain amount of, I wouldn't say pain, but certain amount of heaviness and sort of a sense of fatigue in the lower part of the chest because of the chest muscles having to work very hard to breathe. So that can be expected. It is not normal, and it should, again, like I said, be progressively improving over days. But if it is a persistent pain, if it is a very sharp pain, it's something that needs to be evaluated with a chest X-ray or perhaps something else, but that would need visit to a doctor. For the second part, which I mentioned, is that the sense of fatigability, and when you're sitting down, the sense of heaviness in the lower part of the chest, especially in those patients who've had oxygen requirements or had higher levels of COVID infection, certain rehabilitation measures in terms of keeping certain postures and certain exercises that can be done would be helpful. I think Dr. Aman can explain a couple of brief exercises that would help with that.
Yeah, as very rightly explained by Dr. Mayank, the reason could be doing exercise in an improper position or a faulty posture. So one of the reason could be doing a high force intensity breathing exercise. So such patients should meet physiotherapists if the cause is muscular. Okay, we teach them few breathing like right technique of breathing exercise and a right posture and few relaxation technique to take care of this pain. And we can also use some thermotherapy like hot or cold packs to relieve the pain.
Okay, all right, that was well explained by both of you. There is another question that we have from Dr. Shubhra. She says, "What are the steps for people who have diabetes? What are the things that they should keep in mind while recovering from COVID?"
From the very beginning of COVID-19, we have clearly understood that patients with diabetes have an increased risk of complications. So it's very important that the patients with diabetes not only take care of the COVID bit, but are equally aware and conscious and careful about maintaining proper diabetes or sugar levels. Two or three important points here that need mention here is one is that patients with diabetes tend to ignore their sugar levels because they're more concerned about their COVID infection. Many people in the family have gotten infected, so that sometimes unintentionally tend to ignore their blood sugar controls, which is very wrong and which can turn out to be very harmful. So it's very important that even though you may not be able to get your blood samples done from a lab or go to your doctor for consultation, just make sure that you're checking your blood sugar levels regularly at home with a simple glucometer. And if these values, for example, if the fasting values in these monitoring exercises turn out to be more than 130, or if your postprandial or after meal sugars, 2 hour after meal sugars turn out to be more than 200, you should definitely seek consultation with your doctor to get these measures corrected. This is for the diabetic patients. Though the problem is not just limited to those who already have diabetes. Patients sometimes who've not had diabetes or no history of diabetes will have high blood sugar levels once they get infected with COVID-19. This may be just because of the disease itself, or sometimes is complicated by the steroids that are prescribed for COVID-19. And then this leads to a whole lot of complications, starting from delayed recovery from COVID and ending up to even very severe lung involvement in these patients. So even these patients should, like I said, basically just monitor their blood sugar levels. And this monitoring should not end at recovery, but should continue for at least 4 to 6 weeks post-recovery, because the blood sugar levels tend to get sort of a delayed recovery even after recovery from COVID. So be very careful about monitoring your sugars. And the two values to remember here is fasting more than 130 or postprandial sugars more than 200. Please get in touch with your doctors and get this looked at.
All right, thank you for that. Actually, related to that, there is another question about a lot of people often think that since they've been given steroids during COVID treatment, there might have been an increase in their blood sugar levels. But in your opinion, is it possible for people who did not have diabetes previously to maybe develop diabetes in the future because of the steroids that they were given?
Yes, we've known for a long time that steroid-induced diabetes is a real entity. Some of these patients may be pre-diabetics, they may not know. They may be pre-diabetics, and the steroids as well as the COVID infection itself may push them over the edge and make them into the diabetic range. Some of them may have reversible increase in blood sugar, so they are prescribed steroids. For about 8 to 12 weeks, they may have high blood sugar levels. And as the body recovers from the infection, as well as from the effect of steroids, their blood sugar levels come back to normal. And this, of course, is helped if during this time they maintain a proper diet and exercise plan to control their blood sugars. The question was whether steroids can cause diabetes. Yes, they can. Steroids can make your pre-diabetic range pushed forward into the diabetic range, or they can also be the reason for new onset diabetes. But this is usually there in people who have a genetic predisposition for diabetes because of a family history of diabetes, or who have other comorbid conditions which encourage diabetes, like obesity, or those who have a very sedentary lifestyle. So these are things that you can correct. You can correct your sedentary lifestyle, you can correct your diet. So if steroids were required and were given to you, the least you could do is take care of your diet and your exercise.
All right. Actually, in that respect, I have a question for Dr. Aman. So, Dr. Mayank mentioned that people who don't really exercise, who led a sedentary lifestyle so far, they can start changing that. So, for them, Dr. Aman, would you maybe suggest a few exercises, some easy exercises that anyone, for that matter, anyone across age groups can do at home?
So, sorry, Sakshi, your voice was not clear. Please, can you say?
Sure. So what I was saying is that Dr. Mayank just mentioned that a lot of people have led a sedentary lifestyle. So, they should be able to change that, and they should change that. The time to change that would be now. So with respect to that, are there any easy exercises that you might want to suggest for people who have so far had a no exercise life, a life full of no exercise?
Yeah, sure. So they can start with very mild, general, basic exercises like active range of motion exercises, starting from head to toe. Okay, neck movement, shoulder circular movements, arm circular, elbow bending, knee bending, ankle toe movements. It's a very basic, simple mat exercise they can start with, and then gradually, and also they can start with the walk. Okay, basic walk of 10 to 15 minutes in a day, and then gradually they can progress to 30 minutes of walk every day. And from general range of motion exercises, they can progress to strength training or high intensity exercises. But to start with, general basic exercise is what we advise.
All right, I'm sure that is helpful. Now, before I go on to the next question, I will ask our viewers that if you have any questions, whatever they are, you can please feel free to drop in a comment. If we are not able to take them up during the session, we will take them up by the end of the day. So we have another question by Sunita. She says, "Is there any way to increase oxygen levels?"
So I think Dr. Aman can answer that better in terms of what deep breathing exercises and chest expansion exercises, etc., help in oxygenation. I don't think there's a medical way to do that. It's just physical and physiotherapy or expansion exercises are the way to go. So Dr. Aman can elaborate a little bit on that.
Yeah, so they can start doing deep breathing exercises. Basically, they can focus on segmental expansion and a thoracic expansion exercise, very effective to increase oxygenation. And they can also get in touch with physiotherapists for the post-COVID rehab program, which helps to increase the oxygenation and it increase the also helps to improve the lung function and capacity.
So, Dr. Aman, I think the viewers would like to listen a little more about the program that you're running because it's proven to be quite helpful for our patients. And then perhaps Sakshi could tell the viewers as to how they could get enrolled in the program.
So this program is a post-COVID rehab program. It's for 15 days program where it includes 7 sessions of guided breathing exercise technique with physiotherapist and 3 consultation with the medicine consultant and 2 consultation with dietitian for the nutrition consultation. And this program can be offline or online. Both mode is available. Okay, and this is for 15 days program. And the purpose of this program is to improve the symptoms of dyspnea in post-COVID patient and to improve the quality of life in post-COVID patient and how they can get back to their physical routine, pre-COVID status routine.
All right, thank you for that, Dr. Aman. For anyone watching, and if you are interested in enrolling for the post-COVID rehabilitation program, you can call us on 4211-1111 and then dial 6. Moving on to the next question. There is again a question from Sunita, and she says that her BP has fallen after COVID. Dr. Mayank, is there any specific reason for that or anything that you would advise her?
Well, the information I have is a little less. I would like to know if she's on any other medications. Is she already suffering from blood pressure or any other illnesses and what medication she's on right now? Broadly speaking, if she's at home, if she's feeling comfortable enough and the blood pressure is just low on the readings that she's taking on a blood pressure instrument, one thing to remember is that the digital blood pressure instruments at home can sometimes give you a fallaciously low reading, which may not be the exact true reading. So the first thing that you go by is how you're feeling. If you're feeling dizzy, if you're feeling lightheaded, and the blood pressure machine is showing a low blood pressure reading, yes, it is something to be concerned about and to get in touch with your doctor. If it is just the blood pressure machine which is showing you low values, but you feel fine, you feel energetic, there's no lightheadedness, it may not really be a reason for concern. But having said that, it still would require a review of any medication that you're taking. Some of the medications might require change in dosages. At home, what you can do right away, if you have such a situation where you feel that your blood pressure is low and you feel certain dizziness and lightheaded symptoms as well, take certain amounts of fluid, preferably something with salt and sugar both. If you're diabetic, obviously you omit the sugar. You could also take a slightly stronger cup of tea or coffee. That should help boost your blood pressure up a little bit. Make sure that you're drinking enough fluids throughout the day, 1.5 to 2 liters per fluids every day with adequate amount of salt in your diet. And then at the next available opportunity, consult your doctor to see if there's anything that medically needs to be done for it.
All right, okay. We have another question. This is a little bit of a specific question, Dr. Mayank, but you can answer it as broadly as you think possible because, like you said, a lot actually depends on the actual patient's history. So there is a question from Raj. He says that his mother recovered from COVID and she has diabetes. She was suffering with a left ear and head ache. After a CT scan and MRI, they found out that there was a bit of a sinusitis infection that was causing the ear pain and also pain in the left side of the head. But she is getting relief, but the frequency of pain is sort of controlled. It not controlled. It arises after 2 days or maybe one day. Most of the time, she feels pain in the night. Is there anything that you might want to suggest to them, Dr. Mayank?
Okay, so let me just summarize what I've understood from the question and also for the other viewers. So, this lady has just recovered from COVID. She is a diabetic patient. She started having some headaches on the left side of the head and left ear. The CT and MRI have suggested sinusitis. The pain is still not getting better with the medications. The intensity is the same, and she gets it at intervals of about 1 to 2 days. And the pain worsens at night. So, this is the situation, right?
Yeah.
Uh, well, so one or two things again. You like you rightly said, it's a little broad for me. Without physical assessment, I wouldn't really be doing justice to the diagnosis. But just as a scenario, I would answer it as a scenario, not specifically for her. So any patient who has a uni-sided or one-sided headache could have sinusitis, as was pointed out in the CT and MRI. But the sinusitis could just be coincidental and may not be the real reason for a headache. The headaches in such patients, there are a class of headaches which are known as cluster type headaches, which are triggered by acute illnesses, are more common in diabetics. It could be that. And the CT and MRI may have just brought out a sinusitis which was not the culprit this time. Also, the headaches occurring just in one part of the face and the head and being at intervals of 1 to 2 days points a little against the diagnosis of sinusitis. But like I said already in the last couple of questions, a physical assessment here would do better justice to her diagnosis and treatment.
All right, that's a fair answer. There is another question that we have from Praveen. He says, how important are multivitamins for maintaining immunity? I think you've already sort of touched upon this a little bit before, but in case, just to answer
Yeah.
that part.
So, yeah. So I think they just for COVID as well as for general, see, you should always take medicines only when you're absolutely required to take medicines. We're not born to take medicines. We shouldn't be taking medicines, right? What we should be focusing on is to maintain a healthy, balanced diet. But having said that, if you are specifically deficient in certain things, if, for example, you're specifically deficient in a vitamin, in vitamin D, in vitamin B12, etc., we should give you targeted therapy for that particular deficiency for a particular defined period of time. Multivitamins shouldn't be popped off throughout your life. Sometimes this, sometimes that. That's not the way to go. Just make sure that you're having a balanced, healthy diet. And if even after that you come up with a certain deficiency, we give you the targeted supplementation for a limited period of time. So I think that should basically make the concept clear for the use of multivitamins.
All right. There are a few vaccination related questions that we have. There is the question from, actually, this is anonymous. So the question is that for anyone suffering from neurological conditions, are the vaccinations safe?
Sorry, neurological or urological?
Neurological, related
Neurological,
to
as
the,
in the brain. Yeah.
yes.
Yeah. So, broadly speaking, I don't think there's any contraindication of using or getting these patients vaccinated. Broadly, these situations, like, I would just broadly name out a few that come to my mind right away. One is epilepsy or having any sort of seizure disorder. The other is if you've had any history of stroke in the past, if you're suffering from migraine, if you've had any history of head injury more than 3 months ago, if you've had any neurosurgery done to your brain for any reason more than 3 months ago. With all these conditions, you're still qualified, and in fact, you should be taking the vaccination. So, no contraindication.
All right, that's good to know. There is one more question about paracetamol. So a lot of people have this notion that they should take a paracetamol before they get vaccinated, just as a precaution. About that, Dr. Mayank, is there anything that you would like to tell them?
Well, so there is no guideline to say that you should get pre-medicated with paracetamol, or whether that in any way prevents any side effects if that is what you're trying to preempt by taking a paracetamol. In fact, I would rather suggest the contrary. Please don't take a paracetamol before you go for a vaccination, because after the vaccination, if you do experience some side effects, we do not want it to be masked by a paracetamol that you've already taken. Because if you do have a side effect, we want to know what the side effect is. We want to act accordingly. We don't want to be masking anything by a medication that you've taken prior to the vaccination. So yeah, don't take a paracetamol before you go vaccinate. Just take your confidence along when you go for the vaccination, not a paracetamol.
Okay, that was a good way to put it. There is another question from Sneh. She says, are increased cholesterol levels a result of the COVID medications? Can this be controlled using diet post recovery?
Well, again, a little subjective, because cholesterol levels could be variably affected in the different patients. Some may have a higher triglyceride level, others may have. There are different types of cholesterols that could go wrong in a patient post-COVID. None of the medications specifically has a known side effect on the cholesterol profile. Uh, but yes, if your cholesterol levels are a little off, diet and lifestyle modification is the first corrective measure that you should be looking at. In that context, reducing the fat content in your diet, having more of fiber content in your diet, and reducing the fat or ghee or mustard oil, whatever you're cooking your food in intake, to less than 5 ml per person per meal should be a good starting point to dietary manage your cholesterol levels. You could wait for 3 months, observe your cholesterol levels after 3 months, and if they're still high, could probably seek a medical consultation. But having said that, if you're suffering from a heart disease, if you're suffering from a kidney disease, then higher cholesterol levels would need to be addressed more urgently. Then you should visit your doctor urgently, not wait for 3 months and see for correction.
All right, okay, that was quite a detailed answer. Dr. Aman, there is a question about pruning. Is there any specific, are there any specific benefits maybe of pruning, and can they be done on a regular basis even if the person does not have COVID?
Yeah, so there is no harm doing proning if even if you don't have a COVID. Proning is a very good ventilation technique. Okay, this should be done 2 to 3 times a day if you are recovering from COVID. If you are in a post-COVID phase, 30 to 40 minutes each time.
Okay, all right. That was helpful. Also, Dr. Aman, is there any specific do's and don'ts maybe that people should keep in mind while exercising?
Yes, so do's and don'ts for breathing exercises are like breathing exercise to be done in a slow and rhythmic manner, okay, and always breathe in through nose and out from mouth, and avoid doing breathing exercise on a full stomach, okay, and relax breathing exercise first we recommend, it's very important, and sit in a proper erect posture, okay, while doing the breathing exercise, and take enough breaks in between, okay, and do take care of red flags, okay, and please do not overexert yourself because this will further aggravate the fatigue. And I have a question here for Dr. Mayank. Dr. Mayank, do you recommend anything specific for patients who experience any of the warning signs while doing breathing exercise?
Yeah, so in fact, I was about to ask you a line on question on the same lines, but before that, to answer your question, if you have any of these red flag signs, or if you have any of these warning signs regarding increase in breathlessness, etc., you shouldn't push yourself to exercise further, and then perhaps seek a consultation with your physician to clarify any medical conditions that might be affecting you, or seek a guided exercise escalation program under care of a physiotherapist. But sorry. So a related question I had was that quite a few of the patients post-COVID are getting discharged on home oxygen therapy. So would you suggest these patients also should do certain breathing exercises at home? And would the breathing exercises that these patients do, or for that matter, patients who are discharged on a slightly lower oxygen saturation level of about 90 to 92% or are getting levels in these range, should they be exercising as well, or should they not be straining themselves? And if they should be exercising themselves, are these exercises in any way different from the other exercises?
Yes, they should be exercising even if you're on oxygen or you're not on oxygen, you should be exercises. But again, if you're on oxygen therapy, I would recommend you should start with very gentle breathing exercise. Please don't push yourself to a forced breathing exercise. Later on, once your oxygen saturation levels are okay, you can start doing forced breathing exercise. But to just, I said, start with gentle breathing exercise and progress to forced breathing exercise once you are off oxygen. But during if you are on oxygen supplement, if you are on oxygen therapy, start with basic breathing exercise, gentle breathing exercise like gentle deep breathing, gentle segmental expansion exercise, or a thoracic expansion exercise.
And in these patients on oxygen at home, when they exercise, do you suggest any increase in oxygen level therapy of? I mean, should they increase their oxygenation input levels before they start exercising, or should they monitor their saturations? How should they go about it? Or should the exercise be only guided under supervision of a medical professional?
Usually, if you are on oxygen therapy, you should be doing exercises under the supervision of physiotherapists. This can be done through telemedicine, or once you are comfortable, once you gain your strength back, you can start coming to physiotherapy or a pulmonary rehab setup. Okay, ideally, these type of patients are ideal for pulmonary rehab setups.
Yeah, so
Okay, and
that's the point that I also sort of wanted to highlight. That patients, many of them after prolonged hospital stays, are getting discharged on oxygen and continue to maintain a borderline oxygen saturation level at home. Though they should do non-exertive exercises at home, but still they should have some way of getting in touch with a guided professional. I mean, for guided therapy with a professional like a physiotherapist, maybe just online for that particular session, because that real-time monitoring of your oxygen values and what to do if you desaturate while you're doing these exercises is very important for these patients. So I would also strongly recommend it that these 1 hour, maybe or 30-minute sessions every day for such patients should be guided by a medical professional.
All
So
right, that
we
was
do. So we do have a facility of online physiotherapy or a telephysiotherapy, okay, wherein patient can get in touch with appointment section here, and they can book a slot for a telephysiotherapy.
all right. So that was well presented, both of you. We will be taking up a few more questions that we've been getting now, but at this point, if there is anyone who has not left a question as yet and really wants to ask something, please don't think that your question is silly. No question at all is silly. So if you have a question, please feel free to drop it in the comment section below, and we will do our best to take it up. If we are not able to, then we'll get back to it by the end of the day. We have a question now from Monica. She says that when she does breathing exercises, her lips begin to shake. Is that a sign of fatigue, and what can she do about it, Dr. Aman?
This is I would like to see this patient physically, because I think her breathing technique is not right. Okay, she need to learn right breathing technique or a relaxed breathing exercises.
All right, that's a fair point. There is one more question, this time from Rakhi. She says that how does COVID-19 affect thyroid? And is there any specific rehab measures that you would suggest to be taken up, Dr. Mayank?
The thyroid hormone or the thyroid gland per se is closely related to your body's metabolism. And once you are encountered with an infection, that obviously poses a challenge to your body's immunity, and that requires your body's metabolism to sort of change itself in a certain way to adapt to the challenge of infection or the challenge of fighting the infection. So yes, patients with thyroid disorders, and hypothyroidism is the most common thyroid disorder. So these patients will see a change in their TSH values, which would require perhaps a change in their medication that they take, in the dosage of the medication that they take. Usually these changes last for about 3 months, and then the body sort of tends to go back to the baseline thyroid levels. So again, like I said, as with diabetes, it is important to monitor the TSH values for patients with thyroid during the COVID infection, and then also in the post-COVID phase of about 6 weeks after they've become positive for COVID. As for the physical rehabilitation, some of it would be general rehabilitation in terms of exercise, etc. I don't know if Dr. Aman has something specific to add to the thyroid rehabilitation.
There's nothing specific for thyroid rehab. General rehab like cardio exercises, 30 minutes every day, 5 times a week is a guidelines for thyroid patient and a diabetic patient. There's nothing specific for thyroid.
All right. I think this was quite an informative discussion that we've had. We've answered quite a few questions. Still, I would like to reiterate that if there is anyone who has a question that we have not covered or that has not been answered in the discussion previously, please don't hesitate to drop us a comment, and we will get back to you by the end of the day. Thank you so much, everyone, for joining in. Until next time, stay safe.